Hello, everyone. We're going to discuss our C-section workflow improvements, okay? So starting out, I want to go over our bear huggers. So we want our patients connected with air flowing to the bear huggers before their C-section, during their C-section, and after their C-section. There's two different ports. This port is for the OR. If you can see, it's wider. And then there's an additional port down here by the patient's right thigh that's smaller. This port fits our peri-op bear hugger machines, whereas this one fits the OR much better. So the reason that we want to keep this air flowing continuously is to maintain our patient's temperature. We want them to stay within a normal temperature. We also don't want them to get too hot or too cold because it can increase their infection rates or their ability to heal. So with that being said, we know that a lot of our patients get very anxious prior to their C-section. A lot of people get sweaty when they're anxious. So if we can continuously deliver this airflow throughout this bear hugger, it's going to help prevent any sweat at that incision site. Another factor is these gowns are multi-layered. They make people sweat alone, even if they're not anxious. So it's even more important to make sure that we have air continuously flowing throughout this gown, through the patient's whole journey, pre, during, intra-op, and post-op for their C-sections. Moving on to clipper prepping. We want to make sure that our clipper prepping is performed prior to going to the OR. So that would mean in peri-op for scheduled C-sections or in the labor room prior to rolling to the OR. If your room does not have clippers in it, please let me know and we'll make sure that they get replaced. I'm going to go ahead and lift our gown and talk about proper clipper prepping technique. So I think it's helpful if you have your patient lean back so we can fully assess the incision site when we're talking about if we need to clipper prep or not. Our goal with clipper prepping is to get the hair short, about a grain size of rice. We don't want to completely get rid of all of the hair because that will expose the skin, which can lead to us developing an infection in that area. So as long as there's still hair in that area, we know that the skin is intact in that area. So looking at our clippers, we can go ahead and just put the clipper head onto the handle straight from the tray. Looking at the actual clipper head, there are 2 rows of teeth, if you can see that. So this bottom layer is stationary. This is a safety factor. Whereas this top layer goes back and forth. We do not want that back and forth motion directly on the skin because it can cause cuts that we can't even see with our naked eye. So we've noticed in the past, myself is one of them, that we tend to rake the clipper head in hopes of getting rid of all of that hair. But that's not the goal here. So proper technique is to hold this clipper head with the red 3M facing the ceiling. This stationary row of the clipper head should be what's against the skin. That's going to help protect the skin from getting any cuts. So you want to, obviously with clean gloves on, pull the skin taut and you want to go against the hair growth. Remember that the goal is not to get rid of all the hair. It's just to make sure that the hair that's there is short. Okay. So I know that going against the hair growth feels cringy. However, it is best technique. Okay. So once we feel that we have clipped to the best of our capabilities, we are going to go ahead and dispose the clipper head in the sharps container. When it comes to washing this clipper handle, you can actually submerge this handle in water. Excuse me, you just want to make sure that the base is dry prior to redocking it so it doesn't cause any rust on these boards. You can also clean this off with a purple wipe. I just think that running at least the head underwater will help get some of those clippings from out of there. To collect all of the clipped hairs, we've actually gotten these sticky mitts that you can use to collect all of the hair. I think it's really helpful because as you try and wipe away with a washcloth and whatnot, it just never feels like you're getting all of the hair. These sticky bits are going to be in our add-on C-section bags as well as in our peri-op admission carts. So it's all ready for the nurse to perform the clipper prepping. Okay, so fast forward to when our patient is in the OR. We are going to go ahead and perform the badge cleaning with the HIPAA-Cleanse wash. That is the same workflow as we do with iodine. We're just swapping out iodine for HIPAA-Cleanse. That should be performed with sterile gloves, just like it was expected to do that prior as well. So now let's say our patient has a blanket on her, and then she's already secured to the OR table. We're going to fast forward to our HIPAA-Cleanse cleaning. So we want to make sure that we're wearing sterile gloves anytime we're using HIPAA-Cleanse. Before, we had been using just clean gloves to wash the abdomen, but I think it's really confusing considering we can use the HIPAA-Cleanse for a splash, an emergency splash, because that's also replacing the iodine. And we also don't know when things could turn into a crash C-section. So I think it's important to correlate the things HIPAA-Cleanse with sterile gloves just to maintain consistency. Okay, so with our sterile gloves, we're going to go ahead and what we can do, so we're going to get this blue towel from our scrub tech. They should not be putting the blue towels into the buckets anymore because that breaks the sterility. So the scrub tech is just going to hand the nurse the blue towel while they already have their sterile gloves on. The nurse can either have someone pour this HIPAA-Cleanse packet onto the blue towel and onto the patient, considering the outside of this packet is not sterile. However, in emergencies, we totally understand there's only so much time. So the actual HIPAA-Cleanse product is going to clean as much as we would maybe contaminate by touching the outside of the packet. I hope that makes sense. So you can either pour your HIPAA-Cleanse onto the blue towel or directly onto the patient, or both. Then I'm going to go ahead and throw that packet away. I'm going to start by cleaning at the incision site and work my way up the abdomen. I'm going to then go to the outer thigh, work my way in, the opposite outer thigh, working my way in. I'm going to go to just the pubic hairline, get all of the perineum, and then throw my towel away. So prior, when we were doing our HIPAA-Cleanse cleaning, we just kind of used it mainly to get the ultrasound gel off. So we just kind of did one of these. However, I would love to get in the workflow of doing the same prep, whether it's a crash C-section or if we're just doing the HIPAA-Cleanse cleaning prior to ChloraPrep, especially because I think it's going to help us to be more comfortable in those crash situations. Because we're already practicing that way. It's like muscle memory. So even with your crash C-section, you're going to start at the incision site, go up the abdomen, get all of the outer thigh, get the whole into the inner thigh, get the whole other outer thigh into the inner thigh, come back to that pubic hairline, and then get all the perineum, throw it away. Okay. Now with a crash C-section, we know that the solution is not going to be dry prior to draping. The good thing about HIPAA-Cleanse is it is not flammable, so we don't have to worry about a flash fire due to our product still being wet. However, I understand that the drape is not going to stick as well, just like it did not as well with the iodine. However, we're just doing the best that we can in these crash situations. Okay, so moving on to ChloraPrep if it is a non-emergent situation. Remember, if it's an emergent situation, you're just doing the HIPAA-Cleanse. Please make sure you're doing it thoroughly, though. Okay, so with ChloraPrep and as well as DuraPrep, both solutions are flammable. With that being said, as the solution is dripping off of the patient, we want it to drip onto a surface that we can eventually get rid of to get rid of that fire hazard. Okay. So we want to utilize drip towels. These are just 2 blue towels you can ask the scrub tech to get, or they may ask you to get a pack of them yourself if they're already utilizing them. Just communicate that with them. What you're going to do is you're going to go ahead and place a drip towel on each side of the patient. I think it's really helpful for the baby nurse to place the drip towel on the opposing side of the patient, so the circulating nurse doesn't feel like she's going back and forth while everyone's waiting for her to perform her tasks. Once both of these drip towels are placed, then we're going to go ahead and put sterile gloves on. We're going to make sure, prior to that we've already opened up our ChloraPrep so we can reach in to grab the stick and maintain sterility. So with our patients of a BMI less than 38, we're going to go ahead and just utilize one ChloraPrep stick. Our patients with a BMI equal or greater than 38, we're going to use at least 2 ChloraPrep sticks. So please make sure that you have an additional stick if your patient meets those requirements already ready. If you do not, I would just ask your baby nurse to grab you an additional stick and help you so you can maintain sterility. So with that being said, I have my sterile gloves on. I'm going to go ahead and pop my ChloraPrep by squeezing this lever here, okay? Now, once I do that, all of the ChloraPrep should go to the sponge. We just want to let it flow on its own. We do not want to shake this aggressively. The reason for that is because what we're actually popping when we perform this is 2 glass vials. These 2 glass vials are what's in this ChloraPrep stick. So if we shake this aggressively, not only could we break the glass down further, risking it going through the filter, but we can also obstruct the flow of the ChloraPrep being able to get to the sponge. So once you pop it, please just let it flow into the sponge on its own. You can hold it over the belly button. That way you're dripping the solution into the belly button and we'll be able to use it. So just like with the DuraPrep, you're going to utilize your 2 Q-tips. You're going to submerge the Q-tips in the ChloraPrep solution. You're going to start in the inner belly button and work your way out, okay? Then you're going to throw these away. Now, for our BMIs less than 38, we're going to scrub at the incision site for at least 30 seconds. Now, keyword there was scrub. DuraPrep was more of a paint solution. We did not want the DuraPrep layered, but with ChloraPrep, it's activated by scrubbing. So we want to be going over the skin site a couple of times to make sure that the ChloraPrep is into the top layer of the skin, okay? So like I was saying, our BMI is less than 38. You want to scrub at that incision site for 30 seconds. After that 30 seconds is when you can continue on to the rest of your prep with this same stick. If you ever need an additional stick, please, by all means, go ahead and use one. But I just want you all to know that overall, our BMIs less than 38 will just be utilizing one stick. Our BMIs greater than or equal to 38, we're going to use the 2 sticks. This first stick, you're going to scrub at the incision site for 2 minutes. Okay, so the reason for this is because with patients with these higher BMIs, they tend to have skin folds, especially when they're sitting. Right now we have them laid out, so it may look like there would not be folds, but we also need to be mindful about their recovery period when they're sitting up. We don't want that skin on skin contact. So we just want to be mindful to clean the area as best possible to set our patients up for success. Okay. So 2-minute scrub for 38 BMI equal or greater to 38. Once you've done this for 2 minutes, I promise you, you do not have any more solution in this stick. So you can go ahead and throw it away, grab an additional stick. That's when you will carry on to the rest of the prep. Okay, so we've completed our incision site scrub for either the 30 seconds or the 2 minutes. Now we're going to carry on with the rest of the scrub. So we're going to go up the abdomen, and we want to make sure while we're going up the abdomen, we're layering, because that's going to help activate the solution. We don't want to do the paint solution like with the DuraPrep, because then the product won't be activated correctly. So make sure that you're getting all the way to the side area of your patient's abdomen. If you're not able to at that point, please make sure to get it at the end. You also want to be mindful not to let your sleeve touch the patient. If you're wearing a yellow gown over a t-shirt, please tuck the yellow gown in your armpit so we make sure there's no contact to the skin that we've prepped. Okay, so we're going to go up all the way to the xiphoid process. The reason that we want to go up so high is because of how wide the cutout of our drape is. So please make sure you're going up to that xiphoid process mark so we know that all of the exposed skin has been properly prepped. Once you have completed the abdomen, you're going to go to an outer thigh. You want to do the whole outer thigh. Remember, you're layering because we're scrubbing, and work your way into the inner thigh. And then you'll do the same on the opposite thigh. Then you're going to go to the perineum. You're going to go to that pubic hairline, and you want to scrub the whole perineum and then throw it away. Start your 3-minute timer. I want you all to be mindful of, I know that I learned back in the day to scrub the thighs out to in, out to in. However, that's technically not clean. That's clean to dirty, clean to dirty. So let's just be mindful to do the whole outer part, the cleaner part, and work our way into the dirtier part. Okay. Then you're going to the other thigh, doing the same thing. Yes, we cause exposure while we're going into that inner part. However, it's way less exposure than we were by going out to in, out to in, out to in, and then the other thigh out to in, out to out, out to in, out to in. Okay, so we've thrown that away. We've initiated our 3-minute dry timer. Once our dry timer is up, we want to take a look at our skin. Does it look dry as well? Yes, we need to wait at least 3 minutes, but we also need to make sure that our skin is dry prior to draping. Once it's been 3 minutes and we see that the skin looks dry, it does not appear wet still from that ChloraPrep solution, we're going to go ahead and throw away our drip towels. Because it's a lot for the circulating nurse to come all the way around to get the towel on this opposite side as well, I do ask that the baby nurse can grab the towel from that opposite side, just to save time for everyone. So then we can go ahead and have the providers place the drape on the patient. Please be mindful. A few things. So DuraPrep had acrylic in it, and that helped for drape adhesion. ChloraPrep no longer has that, or it does not have it at all. I apologize. However, we do still feel like the benefits of ChloraPrep weigh the DuraPrep. So with that being said, once we stick that drape, I really encourage people to really push into the stickiness of that drape on the patient's skin so it will adhere better. Once we stick the drape to the patient's skin, we cannot lift it to readjust. That is pulling up the prep, and that means that we have to completely start back over with ChloraPrepping and wait for it all to dry prior to draping with a new drape. It may take longer for the ChloraPrep to dry because it's already layered in some areas. It's similar to layered paint. It's going to take longer to dry. So please just be mindful about where we're positioning the drape so we don't even have to worry about that. Then I wanted to discuss our post-op dressings. So once we're all done, the patient's skin is closed up, we have our new Methylex dressings. These are basically, if you want to think about it, like a big dry Band-Aid, or I'm sorry, a big Band-Aid. So there's Silverline impregnated properties in this gray strip. However, once removed, this whole outer layer is going to be clear, so we can have some insight on what the incision looks like when it comes to healing. So I think that that's very helpful. This dressing can stay on up to 7 days. It can be up to the provider for how long they want to keep the dressing on for. We do encourage the patients to continue using HIPAA-Cleanse during that post-op period, especially around. We don't really want them to scrub on the dressing because we don't want the dressing to come up. But I think that that's really helpful to maintain a clean environment around the incision site as well. Once the dressing is removed, they can continue to use that HIPAA-Cleanse cleaning. It's really up to the provider for how long they want their patients to be performing the HIPAA-Cleanse cleaning. But I think it's really helpful to avoid gaining an infection at that incision site. If this Methylex becomes too saturated, or if it's kind of coming up, we can replace it with a new one. We just want to make sure that we're utilizing aseptic technique to perform that. If you all have any questions, please reach out to me. I would love to answer them. or if there's other things that we need to explore, I would love to dive deep into that. I have this mannequin with me all the time, Quinn. So if you all would like to spend some time going through these workflows to learn yourself, I would love to have you come by and we can do that. Thank you all.